Yes.
Very good morning. I,
Oh,
Dr. Anu Rajesh, welcome you all to this session, second day of the session, LMHI Global Colloquium 2021. May I now request Dr. Josh to introduce and invite the chairperson for the session.
Thank you, Dr. Anu. We have an esteemed chair today, Dr. Kusum Chand. She has an experience of 44 years in the practicing field, and she has completed her MBBS from Maulana Azad Medical College, Delhi in 1964, and her MD in medicine also. And she's MF Home, London in 1975, member of the Faculty of Homeopathy, UK, and also the Central Council for Research in Homeopathy. I welcome you, ma'am, to this session.
Is it for me to start to talk, or is it for? I didn't hear my name. I'm sorry.
Ma'am, we'll invite you in a while. So we will move on to our first speaker for this session. I invite our first speaker, Dr. Mariana from Bulgaria, to present her study on the quality of homeopathic treatment and patient satisfaction.
Please give us the ability to share. Good morning to everybody. Thanks to the organizers to giving us this possibility to talk about a Bulgarian study, which was performed on quality of homeopathic treatment and the patient satisfaction in Bulgaria. It's an author work, and the presenters, the authors of this paper are Dr. Mariana Angelcheva, who is a PhD from Kinesiotherapy and Rehabilitation Department of the National Sport Academy Vasilevsky, and myself, Dora Pachova. I'm a master medical doctor, master in homeopathic therapy, and national vice president for Bulgaria in the Liga. So this is really a unique study for Bulgaria. Homeopathic treatment, a monography. It was performed to get information about improving the organization and quality of homeopathic treatment, and to fully meet the needs of the homeopathic practitioners and their patients. The study has been conducted from the National Center for Public Health and Analysis, and published at on the website of the Ministry of Health in Bulgaria. This is the official link of the website of the ministry where it is published, and it's how it looks. For first time in Bulgaria, we make such simultaneous study with homeopathic doctors and their patients. It was done under the leadership of Associate Professor Dr. Ileana Yaneva, with the assistance of the two big professional organizations of homeopathic doctors and dentists, Bulgarian Medical Homeopathic Organization and Association of Homeopathic Physicians in Bulgaria, which I present. The duration was for 4 years, from 2015 to 2019, and it was done without financial support. This presentation we do in memoriam of Professor Ileana Yaneva, who sadly died in November this year. On the left side of the screen, you see the whole authors list, and this is really a unique experience of so many authors to come together and write about homeopathy. And you can see, if you could read, these are 150 pages, and they extensively give information about education and many other aspects about homeopathy in Bulgaria, clinical as well classical. This is the quota of this study. 557 medical and dental doctors participated, and 547 patients of those doctors participated in the study. The survey was anonymous, and all patients were over 18 years of age. On the right side, you see the distribution. There have been 473 members of the Bulgarian Medical Homeopathic Association, mostly of them practicing clinical homeopathy, and 54 classical homeopathic doctors. This is very important when one reads and understands the results from this data collection. And the patients, respectively, also you see the numbers. Here are the statistical methods used: direct individual questionnaire on paper, documentary method, and the statistical methods are also written. We got a lot of data about socio-demographic characteristics of the homeopathic doctors. Of course, all of them have a master in medicine or dentistry. 50% of them have over 26 years of medical practice. I just have to clarify for the audience that in Bulgaria, one first has to become a allopathic doctor, and after that can study homeopathy and become also homeopathic practitioner and physician. And the 26 years of experience of medical practice speak a lot that we have as a homeopathic community doctors with a lot of experience in medical practice before they turn into homeopathy. 98% of them studied in Bulgaria. On the question, why did you choose homeopathy as additional qualification? 97% of the respondents answered that the conventional and unconventional methods of treatment should be combined for the benefit of the patient. Homeopathic education, you see the number of hours provided. We have different programs here in Bulgaria. And because I'm a person teaching classical homeopathy, our program is 600 hours. This is the standard in Europe also. And as a coordinator of European Committee for Homeopathy, I must say that we are helping the schools to build a program which is adequate for medical doctors to understand homeopathy, basic principles, and start working as classical homeopaths. So on that graph, you see that 11% of the doctors who participated in the study have more than 300 hours experience. It's actually 600. But there was no such option in the questionnaire. Do you think that after the main course of homeopathic education, you can practice the method successfully at your own? Most of the doctors answered, no, I need more education. And this is understandable if you see the hours from the previous slide. Do you participate in additional qualification courses? 95%. When participating homeopathy, do you use other conventional methods? Most of them, yes, 63% use. Here you may see the most frequently methods which are combined with homeopathy. This is phytotherapy, the dietetics, also acupuncture, acupressure, fasting, etc. This is a very interesting slide where we can see the information about the communication and the satisfaction of the homeopathic doctors communicating with their colleagues from who apply conventional methods and unconventional methods. Of course, the communication with those who apply other unconventional methods is better, but overall satisfaction is very good. A little bit information about the insurance companies and homeopathy. 92.4% of the respondents are on the opinion that it would be good if homeopathic treatment is reimbursed by the at least by the voluntary health insurance funds. By 2019, when this research was done, there was no official information and no private companies who were funding homeopathy. As per today, we have already such. And on the next slide, you may see two similar studies done in Hungary and in America about the status of reimbursement of homeopathic treatment. Now about the patients' data. 547 patients. They were divided into 3 groups, as you see. And we have 75% women and 25% men, which is, of course, just giving us information which we know. Women are those who are more responsible for their health and for the health of the families as a whole. This is corresponding with many other studies, a number of studies in the European Union. For example, 50% of the Austrians used homeopathic medicines, 62% of them were women, 73% of women and 48% of men received homeopathic treatment in Germany. Italy, 69% of the users of homeopathic medicines are women. And there is another study showing that patients of homeopathic doctors have a healthier lifestyle, greater faith in holistic healing, and are more willing to take an active part in caring for their own health than patients of conventional primary care. You may see the references for those papers at the end of that presentation. Education, that's also very interesting. Homeopathy is an option which one can choose privately and pay privately, and must look for information about the method because it's not so popular as in India or Brazil or other parts of the world. So our respondents are, as you see, with higher education status. 67, almost 67% have a university degree. On the question how they found this method of treatment, you see that almost 40% got a recommendation from a relative, and 36% got a recommendation from a friend. On the question why you visit exactly this homeopathic physician, again, the answer is he was recommended to me. Why did you visit a homeopathic doctor if you have been treated allopathically before? This is also very interesting. 49.1% answered that they want to use a method which is more safe and has no side effects. And 41.5% answered that the conventional treatments didn't help them. This and 16% answered there was no amelioration by the conventional treatment before they turned to homeopathy. The satisfaction of the patients. Are you satisfied with the way the homeopathic physician treated you? We have really very good data. 67% answered very satisfied and 29.4% satisfied. So we can't really expect more. Would you visit the same homeopathic physician for another healing health problem? Yes, as you see, majority answered really that they will go to the same physician. I remind you that it's a personal choice. How would you estimate the effective homeopathic treatment? 60% with amelioration, 27% almost completely healed, and 8.5 still early to estimate. Why would you recommend this homeopathic physician to family and friends? Answer is again, why will you recommend? I will recommend because I am really satisfied with him. Do you think the homeopathic treatment should be paid by the insurance companies? Majority, 91% answer yes. 81% of the patients state that the main reason for their high satisfaction with the homeopathic treatment are the results of the treatment, and 44% have given additional answer or one answer that the individual attitude towards the patient as a person was a real cause for satisfaction. And 33% patients rate the good attitude, attention, responsiveness, and understanding. So this speaks really very good about our homeopathic community.
Dr. Bora, your time's up. So I would request you to conclude as soon as possible.
Yes, this is the final slide. How do you estimate the quality of the homeopathic services in Bulgaria? You see the graph. I will not talk, but we really have very good, excellent feedback from the patients. So this study shows a high overall satisfaction of the patients with homeopathic treatment in conditions of a seriously challenged healthcare in Bulgaria. Here are the references, and this is our final slide. Thanks again for the possibility to be with you in this session and to share our research. Please do not hesitate to ask us any further question. You see our mails, and good luck, Happy New Year, and all best wishes to all participants and organizers. Thank you.
Thank you, Dr. Dora, for your presentation. I would now request Dr. Kusum Chand to give comments regarding the session.
Thank you, Dr. Mariana, for a very enlightening talk on the way homeopathy is practiced in Bulgaria. I have one question with you, because all the doctors have to first become regular doctors, then they become homeopath. So what is the reason for a regular doctor becoming a homeopath, especially when you have to make the payments? The study is private, and then the homeopathic medicine treatment is not reimbursed there. So what makes a regular doctor change over to homeopathy?
Mariana, ти ли ще отговориш или? This is a really very interesting phenomenon in Bulgaria, in Europe in general, because homeopathy is reimbursed in just few countries. So most of the doctors are coming to the path of homeopathy because of their personal development. As doctors, their personal development, spiritual development, if you say so, and many of them are really dissatisfied with the results of the conventional treatment. We both are teaching in our homeopathic school, Edicta, and most of the doctors who are coming here have one or two even specialties in conventional medicine. And they have a lot of experience, most of them. We lack really young doctors studying homeopathy. Most of them are coming because they understand that they need something more. If I can answer in a short way. And it's very interesting for a person to educate on homeopathy people who are really with conventional thinking, cardiologists or obstetricians or pediatricians. The biggest percentage of our students are pediatricians. That's also interesting.
Thank you.
Thank you.
Thank you.
Thank you, Dr. Dora and Dr. Mariana, for a wonderful presentation. Next, I invite our next speaker, Dr. Kawal Sethi from India, to present her study on the scope of homeopathy in achieving sustainable development goals. Over to you, ma'am.
Is my screen visible and am I audible?
Yes,
Yes.
ma'am.
Good morning, everybody. Thanks a lot for giving me the opportunity to be the part of this virtual marathon and connecting everybody globally. Yes. So why this? What are sustainable development goals? Am I audible?
Yes,
Hello?
Yes, ma'am. You are audible.
Yeah. United Nations Sustainable Development Goals are 17 goals with 169 targets that all UN member states have agreed to work towards achieving by the year 2030. They set out a vision for a world free from poverty, hunger, and disease. Health has a central place in SDG 3. What it says, ensure healthy life and promote well-being for all at all ages. Underpinned by 13 targets, they cover wide spectrum of WHO work. Almost all other 16 goals are related to health, and their achievement will contribute to health indirectly. So what are these goals? No poverty, zero hunger, good health. Third point of SDG, which is of great relevance to us, but ultimately connects to all. Quality education, gender equality, clean water and sanitation, affordable and clean energy, decent work and economic growth, industry, innovation and infrastructure, reducing inequalities, sustainable cities and communities, responsible consumption of production, climate action, life below water, life on land, peace, justice, and strong institution partnership for the goal. These 17 SDGs have been derived from 8 millennium goals. In year 2000, WHO actually gave 8 millennium goals. Those were quite related. That was related to poverty, hunger, universal primary education, gender equality, child and maternal mortality, combating infections like HIV, AIDS, malaria, etc. And then environment sustainability, development, global partnership and goals. Now I would just like to add why I have chosen this. I was really impressed by Greta Thunberg. You know, a small school girl created furor in the world, made everybody think how climate is important. And all these goals are somewhere interlinked to each other. In the present day, nothing is in isolation. Nothing works in isolation. Everything at every point is integrated. And then the letter written by, for a signature campaign, written by Dr. Bernardo, General Secretary, and which came to us through our National Vice President, Dr. Niranjan Mohanty. What does it say? We are enlightening, emphasizing WHO and predicting that civilization faces a crisis of antibiotic resistance diseases that may result in 10,000 million deaths a year, not a small number. Then what will be the impact? More than 24,000 million people will be below poverty line. There would be extreme poverty. Worldwide, homeopathy have been successful in treating millions of patients most gently and economically, does not cause any antibiotic resistance, then how this antibiotic resistance impacts? It impacts greater disease burden, greater financial burden. So by covering these 17 SDGs with one single point, good health through homeopathy. So that is the main idea behind taking this topic. So now, though the goals are broad and interdependent, on 6 July 2017, the SDGs were made more actionable by UN resolution adopted in the General Assembly. The resolution identified specific targets for each goal along with indicators that are being used to measure progress towards each target. The year by which the target is meant to be achieved is usually between 2020 and 2030, and some of the targets, no end date is given. It is a sort of a 15-year program, 2000 to 2015 Millennium Development Goals, followed by Sustainable Development Goals. The target date is 2030, but it's a continuous process. Next slide. To facilitate monitoring, now SDG trackers. Everything requires monitoring. Everything requires a constant monitoring whether what is being decided is being implemented or not. Otherwise, down few years, why the Millennium Development Goals were not effective? Because of the poor governance. So to overcome that, SDGs have developed SDG trackers to facilitate monitoring. A variety of tools exist to track and visualize progress towards the goal. All intention is to make data more available and easily understood. For example, the online publication of SDG Tracker launched in June 2018 presents data available across all indicators. SDG 3 has been assigned, that is health. Any healthy nation is a wealthy nation. SDG 3 is the most important, has been assigned 13 targets and 28 indicators by United Nations. Indicators provide the matrix through which the world aims to track whether these targets are being met. The 13 targets are as follows: global health, polio, life expectancy, maternal and child mortality, communicable diseases like malaria, HIV, AIDS, mental diseases like suicide, disease burden, disease eradication, causes of death, healthcare financing, and smoking. So, what are the targets and what is SDG 3 targets and indicator? This we have spoken. Sorry. Strategic objective. We must take a methodical approach to develop strategic objectives and actions that include the key parameters for an ideal healthcare system to achieve good health and well-being described in third Sustainable Development Goal. What are the 3 key areas where homeopathy is indispensable in achieving SDG can be summarized through 3 P's. Primary healthcare, poverty, and pollution. Primary healthcare is the most important, where we can treat, curtail the need for secondary and tertiary care. Then how it impacts? If the disease is dealt at the primary level, it reduces the cost dramatically, reduces the need for bigger infrastructure, bigger medical care. So it helps in alleviating poverty. Then pollution. Pollution is one biggest factor which is making all of us suffer like anything. And presently, the condition in a place where we are living, Delhi, every day we see the air quality index and how it impacts. pollution can impact us in many ways. If there is air pollution, higher incidence of respiratory disease. If there is water pollution, higher rate of communicable diseases, and all kind of diseases we get more prone with pollution. Even diseases like cancer are greatly impacted with pollution. Then steps for utilizing homeopathy in SDGs. Integrating Ayush services into primary healthcare, promotion of healthcare through community, preventive and promoting aspect of healthcare, optimum healthcare with minimum resources, homeopathy, prevalence, expense and application policies and programs. So integrating Ayush services into primary healthcare, as already mentioned, is utmost important. How it helps? Its availability to people even in the nook and corner of the smallest village. Then through community, every community has a preference for a kind of treatment they prefer, number one. Number two, availability. Number two, how much cost they can chill, how much consultation they can afford. Then preventive and promotive aspect. So prevention, 1 ounce of prevention is better than 1 pound of treatment. So preventive and promotive aspect of homeopathy is very strong. Like we have seen in the epidemic of COVID-19, arsenic album had been so useful in preventive this COVID-19 spread. Then we have so many cases coming to us every day who have not recovered after COVID-19. So homeopathy has shown remarkable results for a promotive aspect, and that then we have a great asset with us, that is nosodes. They can be used as preventive, they can be used post-disease. So bad effects after typhoid, bad effects after chickenpox, and same way we can use them for preventive. And genus epidemic is another great tool which is solely belongs to homeopathy. So thereby we with very minimum resources we get miraculous results. So we have to promote homeopathy's prevalence because of its effectivity and economical means. Then policies and policies are a very big aspect. For the 2-3 days, what we are listening is individual effort. Somebody has done some effort, some very good result in cancer, in all kinds of things. But until there is a robust policy, we cannot move further behind. So, like UN has made a policy, then WHO has made a policy, then it is percolated from international to national level. Then Ministry of Health made certain policies. Then with the making of Ministry of Ayush since 2014, we have got a great leap in all traditional systems and homeopathy. So we have policies to promote homeopathy, and there are many programs, there are many central sector programs, there are many, and in that there we have very good program, that is National Ayush Mission. It helps in many ways. It helps to upgrade institution, it helps to upgrade our pharmacies, it helps to create pharmacovigilance, and for public health awareness, information, education and communication. These policies and programs really help to percolate health. We need strong institutional and organizational support to come from an individual level to national level, and from national level to global level. So policies and programs are of great importance to improve the health of a society and a system and a country. Strong policies and programs are our great support. How to attain these sustainable goals? Health remains the top priority, as most of the human resources utilized for creating healthy world. It saves in terms of poverty, hunger, as financial burden is exorbitant, depleting all the financial resources of the family, during this COVID-19 epidemic, we have n number of data to tell us how so many people has gone beyond poverty line. People have lost their job, they have lost their savings, they have lost their family members, they have lost their earning members. So to attain that, health remains the top priority, and homeopathy being the safe, gentle, similar, a yacht moves more smoothly when the wind is on its side. Since homeopathic system works on similars, so when two things are moving in the same direction, it is easier to achieve. Then
only 1 more minute left. Just to remind.
Homeostasis, it helps. Okay, homeopathy is a medicine for future, and as evident from all these issues discussed, many more. So just I'll reach my conclusion. To attain the sustainable goals, health remains the top priority, and most of the human resources utilized for creating healthy world. It saves in terms of poverty, hunger, and financial burden is exorbitant, depleting all the financial resources in the family. Homeopathy is a medicine for future, as evident from all the issues discussed and many more. With the robust primary care, the need for secondary and tertiary can be reduced phenomenally. Homeopathy has a great role in primary healthcare. It is effective at all the levels: preventive, promotive, and curative healthcare. It is cost effective, widely accepted by masses for long-term health benefits. So by adhering to the homeopathy medication used with its composition, manufacturing process, cost application, development of research and evaluation structure in conjunction with the critical education in the discipline, as well as the development of policies and programs, would aid in the improvement of practices and potential role of homeopathy in comparison to other therapies, both conventional and traditional. In achieving better health and well-being, strategic objective must be made in congruence with the SDG, thereby making Mother Earth a better place to live. I think I've stuck to time. Thank you, and I think
Dr.
my
Sethi,
presentation is over.
Thank you, Dr. Sethi, for your very comprehensive presentations on homeopathy and sustainable development goals. Now we request Dr. Kusum Chand to give her comments.
Thank you, Dr. Sethi. All I can say is thank you for promoting homeopathy.
Thank you. My pleasure. Yes. Thanks for the support, and sorry for the initial glitches.
Not at all.
I feel proud to be a homeopath.
Thank you, ma'am. I invite our next speaker, Ms. Kaylee, to present the study on individualized homeopathic treatment for childhood eczema and standard case-taking tool.
Hello， 大家好。Hello everyone。好感謝咧 LMHI 咧俾呢個平台，我哋可以同大家分享初生嬰兒嘅濕疹個案順勢療法嘅個人化處理。
So we are very happy that to share our case of an individualized homeopathy treatment for preverbal childhood eczema in this LMHI conference.
我哋同大家介紹下香港嘅標準診症工具。
So we are going to introduce the standardized case-taking tool in Hong Kong.
喺香港啊，大概有30% 嘅兒童咧都係患有濕疹嘅。
So there are 30% of the Hong Kong children who have eczema.
咁大概有16名嘅兒童啦。
So there's approximately 160,000 children in Hong Kong.
醫生啊，經常性同家長去保證，大部分患者濕疹咧嘅情況底下都會隨着年齡嘅增長而有改善。
So the physicians often assure that parents that the most patients tend to improve with age.
而佢哋嘅小朋友或者會喺成年嘅數年之後咧，唔再患上濕疹。
And their children may outgrow their eczema some years later.
好可惜係啊！研究指出，大概70% 嘅重度濕疹咧，或者60% 嘅輕度濕疹患者裏邊，濕疹咧會持續到成年期。
However, study shows that the childhood eczema persists into adulthood in approximately 70% of patients with severe eczema and 60% of those with milder condition.
一項香港嘅研究指出，喺嬰兒期低於1歲開始患上濕疹嘅患者咧，到達青春期嘅時候咧，濕疹咧係會更加嚴重嘅。
A study from Hong Kong shows that the patient with onset of eczema in infancy, that is below the age of 1, had more severe eczema in adolescence.
作為咧我哋香港診所嘅兒科患者咧，最常見嘅主訴之一。
So being one of the most common chief complaints in pediatric patients in our clinic in Hong Kong,
提高咧我哋處方質素嘅一致性咧，對於幫助呢一類嘅患者方面咧係非常重要嘅。
it is very important to improve the consistency of our performance in helping these patients.
由於關於兒童患者咧嘅一般症狀同埋變化形式咧，可以用嘅資訊係好有限啦，所以佢哋往往咧都係更加難作出處方嘅案例。
So due to the limited available information on the general symptoms and modalities in pre-verbal pediatric patients, they are very often the most difficult cases for prescription.
對於提示一個嬰兒個案，我哋需要注意嘅事項。
So here's the reminders for consideration of pre-verbal pediatric cases.
受精前啦，
So during pre-conception,
成孕、
during conception,
懷孕、
during pregnancy,
分娩過程、
during labor process,
母乳餵哺、
during breastfeeding,
疫苗刺激、
the immune stimulation from vaccine,
童年期嘅衝擊。
and the life event at childhood.
喺香港嘅標準診症嘅工具裏邊，
So the standardized case taking tool in Hong Kong,
我哋有一個係for兒科患者嘅使用。
that is for pediatric patients.
第一部分咧係會由母親填寫嘅。
The first part will be filled in by the mother, sorry.
喺懷孕史上面，
So during pregnancy history,
媽媽係咪計劃懷孕嘅咧？
is this a planned pregnancy?
過去嘅懷孕同埋生育史，
So the history of pregnancy and delivery,
受孕時候嘅精神同埋情緒狀態，
general mental and emotional status during conception,
喺懷孕前後咧嘅精神、情緒整體嘅狀況同埋佢嘅改變係點樣咧？
during differences in mental, emotional, and general status before and during the pregnancy.
例如佢嘅飲食喜好啦、情緒上面嘅轉變啦、夢境啦、習慣上面嘅改變啦、與丈夫嘅關係啦、工作態度等等。
For example, the favorite in food, emotional changes, dreams, changes in habit, relationship with your husband, working attitude, etc.
喺懷孕期嘅不適啦，例如血糖問題啦、血壓啦、甲狀腺啦、流產先兆等等。
Any medical condition during pregnancy, for example, the problem with blood sugar, blood pressure, thyroid gland, or threatened abortion, etc.
分娩嘅過程又係點樣呢？
So how about the delivery process?
嬰兒出生時候嘅體重啦，
The baby's weight at birth,
生產時候有冇出現乜嘢狀況呢？
any complications during the labor process,
嬰兒期啦，
during infancy,
母乳餵哺啊，定係配方奶粉？點解呢？
was the baby breastfeeded or used formula milk? Why did you choose that?
喺嬰兒時期嘅時候，餵哺狀況係點樣嘅呢？
How is the feeding during infancy?
斷奶嘅情況又係點樣嘅呢？
What about the weaning situation?
睡眠質素係點樣嘅呢？
How is the sleep?
情緒啦、時間嘅長短啦、睡姿啦、出汗啦、出汗嘅位置啦、不同部位嘅溫度等等啊。
So emotion, timing, posture, perspiration and its location, temperature of different parts of the body, and etc.
Okay. 我哋仲會留意媽媽嘅觀察啦，
So from the observation from the mother,
小朋友喜歡嘅顏色啦、玩具啦、遊戲，
so the baby's favorite color, toys, and games,
小朋友嘅獨特個性，佢與其他小朋友唔同嘅地方喺邊度呢？
the unique characteristic of the child that makes him or her different from other kids.
小朋友有啲乜嘢係驚嘅呢？
So what does the baby fear?
佢渴望同埋厭惡嘅食品同埋飲品係乜嘢呢？
So any food or aversion on drinks and any desire on food or drinks.
第二部分咧係由父親填寫嘅。
So the second part will be filled out by the father.
我哋希望從父親嗰度咧獲得獨立嘅資訊係好重要，尤其係咧重複咧係出現嘅狀況。
So it is important to get independent information from the father. The repeated themes should be highlighted.
如果可以嘅話，由其他如果有照顧呢個小朋友嘅朋友咧，咁佢哋去提供咧關於小朋友嘅狀況，亦都係好重要嘅。
If it is appropriate, it can be repeated by other carers as well.
懷孕史啦，
So the pregnancy history,
生產過程啦，
the delivery process,
嬰兒期，
infancy,
父親嘅觀察，
and observation from the father.
我哋都要一一記錄。
We have to record all these information.
而第三部分咧，由父母一齊填寫啦。
So the third part will be filled in by the parents.
成長期嘅里程碑啦，
Developmental milestone,
小朋友嘅免疫針記錄以及針後嘅反應。
so vaccination record and history of reactions,
自出生起啊，佢嘅病歷以及有冇接受過任何嘅治療咧？
any past medical history since birth, and any treatment received before.
小朋友嘅獨特性啦，
So the peculiarity of the baby.
如果可以嘅話，我哋一定會了解埋父母嘅體質。
If possible, it is best to understand the constitution of the parents.
我哋介紹呢個第一個個案啦，
So this is the first case we're going to present to you.
佢係一個2個半月嘅兒童濕疹個案。
It is an eczema case on a 2.5-month-old baby.
呢一個個案，佢不但只有濕疹，而且仲有腸道絞痛伴隨24小時嘅尖叫。
Not only does the baby suffer from eczema, it also has an infantile colic with a 24-hour screaming.
我哋可以簡單觀看一下個視頻啦。
So let us show you a video. So it's basically screaming. There's something wrong with the mic.
咁你見到佢嘅，聽到佢嘅尖叫慘叫聲啦。
So the baby is screaming, and you can see from the facial expression.
爸爸嗰一下嘅無奈啦。
and the father lies back from the screaming.
咁我哋咧會參考媽媽嘅體質療劑咧係山羊奶，
So the constitutional remedy of the mother is lactopeprinum.
而病人嘅獨特症狀咧同母親嘅體質咧係非常相似嘅。
The peculiar points were considered with the mother's constitution.
完成整個診症之後啊，我哋揾出以下嘅獨特症狀。
The following peculiar points were found after full case taking from the tool.
小朋友咧對於聲音係非常之敏感嘅，
So the baby is very sensitive to noise during sleep.
而且咧佢嘅腸胃氣脹係好嚴重啦，
And there is rectum flatus.
而且佢嘅大便係非常之稀嘅，
The stool is thin.
以及咧佢咧有一個好特別嘅症狀，一旦佢躺下咧，佢就會非常之嚴重啦，而且係咧特別較差嘅。
So one peculiar point about this baby is whenever the baby was lying down, the symptoms aggravated.
所以咧我哋 combine 咗幾個咧腸胃咧腹部咧嘅選項啦。
So we've combined these 4 rubrics that are about the pain on the stomach and lying back on the abdomen.
咁我哋咧亦都用奶類療劑咧去做咗一個篩選。
So we've also selected an analytic group of milks.
對於處方奶類嘅療劑啊，我哋發現咧從海豚奶療劑嘅驗證裏邊咧，有趣嘅地方咧同小朋友係非常相似嘅。
So looking into the picked milk remedy, we can find that in the proving of black delvinum, an interesting symptom which is very characteristic of this distal patient.
同樣地啊，
So similarly,
面部沿下顎咧以及耳朵咧都係有溫度同埋痕癢嘅紅疹啦。
so there are warm, itching rashes on the faces, along the lower jawline, up to the ears.
首先咧由右面嘅面頰咧延伸至兩邊嘅面頰。
So it first started on the right cheek and then developed to both sides.
使用療劑1個月後，
So after 1 month of prescription,
情緒咧同埋睡眠質素咧都係有改善，所以佢已經冇再出現尖叫嘅情況啦。
so the emotion and the sleep improve and there is no more shouting during night times.
咁腸痛嘅絞痛咧，咁亦都喺數日之後咧消失。
The colic, it's gone in a few days.
咁面部嘅濕疹，大家見到圖片都係明顯有改善嘅。
So the eczema on the face improved, you can see from the pictures.
咁下肢嘅濕疹咧，繼而有加重啦。
And the aggravation are on the lower limbs as well.
使用療劑3個月後嘅效果，大家見到個面部濕疹已經大有改善啦。
So after 3 months of prescription, you can see the skin on this baby's face has recovered.
咁我哋亦都可以參考下 MONA 計分啦。
So we can take reference with the MONA criteria.
處方嘅順勢療法療劑咧，對於主要嘅症狀係有改善嘅。
So there is an improvement in the main symptom or condition for which the homeopathic medicine was prescribed.
服用療劑之後咧，與症狀嘅改善咧喺合理嘅時間同埋框架內咧係有嘅。
And there is clinical improvement occurred within a possible time frame.
咁佢出現初期嘅症狀咧係冇加重到啦，所以係冇嘅。
So there aren't any initial aggravation of symptoms.
效果咧係咪超出咗咧主要嘅症狀同埋佢嘅狀況咧？係大家見到啲圖片係有嘅。
So there is an effect encompass more than the main symptom or condition. You can see from the pictures shown above.
咁喺整體上面咧都有明顯嘅改善啦。
So there is overall well-being improved of the baby.
治療嘅方向咧，症狀係咪反方向咁樣痊癒咧？咁係一個2個半月嘅小朋友啦，咁所以佢已經嚟嘅時候已經係呢個症狀，所以係唔肯定嘅。
So since the baby is only 2.5 months old, we aren't very sure if there is any old symptoms happening before that.
治療嘅方向咧喺以下咧是否有2項咧最少適用於痊癒嘅方向咧？咁你會見到啦。
So there at least 2 of the following aspects that applies to the order of the improvement of symptoms. You can notice that.
小朋友係先改善咗睡眠同埋情緒嘅狀況啦，繼而先去到腸胃嘅狀態。
So the babies first improve with sleep, and then it goes to the emotions.
所以係由較重要嘅器官去到較次要嘅器官啦。
So it does follow the direction from the organ of more importance to those of the less importance.
咁佢係由腸絞痛跟住先好到去皮膚濕疹，所以係由內嘅方向走去外嘅。
So the colic disappeared in a few days, and then the eczema slightly aggravated. So this followed the direction from deeper to more superficial aspect of the individuals.
你見到佢嘅濕疹咧係由面頰先好，跟住再去到下身嘅下肢嘅，咁所以係由上至下。
So you notice that the eczema develops first on his face and then recovers, then it goes to the lower limb. So it does follow the direction of top downwards.
咁舊有個症狀咧係咪有改善過程中咧短暫出現咧係冇嘅。
So are there a temporary reappearance of old symptoms? So there are none.
有冇其他嘅因素除咗療劑以外咧，可能會引致症狀嘅改善咧？咁小朋友係一嚟到就冇用到其他嘅 treatment 啦，咁所以係冇嘅。
So the baby hasn't been with any other treatment except using a homeopathy remedy. So this question is no.
咁係咪有任何客觀嘅證據證實健康嘅狀況有改善咧？咁病人透過 video 啦，同埋一啲圖片咧，咁大家都可以見到有明顯嘅改善啦。
So there are objective evidence showing the health improvement of this individual. For example, from the pictures above and the video above, you can see that.
咁係咪重複療劑之後會引起類似嘅改善咧？係有嘅。咁會當佢咧係情況有再出現下降嘅時候咧，咁當時咧重複療劑嘅時候咧係有明顯嘅好轉嘅。
So whenever any symptom reoccur, we repeat the dosage, and then there are similar clinical improvements shown.
咁我哋類似嘅個案咧都係有好多嘅。
So there are still many.
I would request
so there are still many more similar cases. These are the few last cases. Last slide, so we're gonna fly over it.
咁已經係 time up 啦，咁我哋今日時間有限，亦都唔同大家分享唔到咁多啦。
So we can't share all of the cases that we can share due to the time limit.
個人化嘅順勢療法療劑咧，對於好多嘅兒童患者裏邊都係有幫助嘅。
So individualized homeopathic treatment could be helpful to many of these infants.
一個標準化嘅個案記錄咧，能夠有效去提高處方嘅質素一致性。
A standardized tool might be helpful to the consistency of a performance.
咁今日同大家嘅分享到此為止，好多謝大家嘅收看。
So thank you for sharing. Thank you for your time, and this is our hearing. Thank you for your attention. Merry Christmas!
Thank you, Ms. Chow, for your presentation. I request Dr. Kusum Chand to give her comments on the presentation.
Dr. Chow, very impressive presentation. What I want to know is what was the potency that you used for the medicine and how often did you repeat it?
我哋用咗個層級係咩程度，同埋我哋幾時 repeat？
我哋咧係用30C 嘅層級啦。
So we use the potency of 30C.
咁咧亦都係觀察咧情況咧，包括佢嘅睡眠啦、腸道絞痛啦，同埋佢嘅濕疹狀況咧，我哋都會喺佢明顯較差嘅時候咧去觀察使用療劑嘅。
So we focus on whether the sleep improvement and the emotion and in general on the eczema improvement, and then we apply the repeated dosage.
Thank you.
Okay, thank you.
Thank you.
CBD code 係 HF162B HF162 boy. Thank you.
Thank you so much.
Thank you so much.
Thank you, Ms. Kaylin.
Thank you.
Now I request our next speaker, Dr. Kishore Kumar Naskar, to present a study on dysregulated cholesterol metabolism in relation to pathogenesis of Dioscorea villosa. Dr. Naskar, over to you.
Yes. Yes, thank you very much. My screen is visible?
Yes, it is visible.
Okay, thank you. Respected Chairperson, Dr. Kusum Chand, and moderator, Dr. Matthews, Dr. Onu, and Dr. Akshaya. My topic is dysregulated cholesterol metabolism, a possible background pathophysiology of homeopathic pathogenesis of Dioscorea villosa. It is a review as well as perspective study based on different scientific research works published in different international journals, and maximum are PubMed index journals. At first, I should say something, what Master says in his lesson writing: no alteration occurs without a cause, and to cure, disease always remains essentially identical to the selected medicine, both in its manifestations and in its cause. So in case of disease, the internal derangement of the patient is the cause, and the external manifestations is the effect. But in between this, the altered physiological activity, that is pathophysiological activity, and on the other hand, the drug has a capability to derange internally. If it is a cause, the effect is external manifestations through altered physiological activity, that is pathophysiological activity. It is the subject of our presentation, of my presentation. Now, according to Stuart Close, related to doctrine of specifics related to drug and disease, the pathological unity of symptoms, a state of pathological condition capable to produce by the drug, when it is successfully applied to the exact nature of pathological unity of symptoms developed in disease, it is the doctrine of specifics, according to Dr. Stuart Close, related to drug and disease. So in drug pathogenesis, the pathological unity in pathogenetic condition or state revealed from proving clinical observations, poisoning, defines a particular drug and its successful application to the disease in the similar type of pathological unity in pathological condition or state found in patient. Now, in the homeopathic pathogenesis of Dioscorea villosa, some important characteristics are feeble digestive power with colic, flatulence colic, bilious colic, and neuralgia of bowels with spasmodic pain in abdomen, colic with diarrhea and dysentery. Related to characteristic modality emulated by stretching the body out or by walking about. But Dr. Pierce, in his plain talks on Materia Medica, experiences this medicine also covers the modality when patient gets relief on bending forward. In liver affections, disturbance of bile secretion, gallstone, and much flatulence along with feeble digestion. In related to sexual excitement, constant sexual excitement, nocturnal emissions with amorous dreams, and erections when asleep, sometimes without erections. And related to vascular affections, acute painful varicocele hemorrhoids. Related to heart affections, angina pectoris, pains radiate into both arms. Related to phalanx or paronychia, early when pains are sharp. In sciatica, right-sided, shooting down thigh aggravation motion. Dr. Boyd reported that Dioscorea has curative property in spasmodic stricture of urethra, that is urethral stricture, and also false labor pain. It has a pathogenesis like false labor pain. The internal activity of dysregulated cholesterol metabolism in relation to the pathogenesis of diascoria. And if it is related to feeble digestive power or abdominal colic, we can find the hypercholesteremia, hypertriglyceridemia, or low HDL levels cause gallbladder disease, develop stones. No. And also find that the accumulation of hypercholesteremia causes inflammatory response in the artery wall in intestine, causes intestinal inflammation to produce colic with diarrhea or dysentery, similar to food allergy. Pancreatic affections due to secondary cause of altered cholesterol metabolism. And hypercholesteremia is one of the well-known causes of non-alcoholic fatty liver disease. Severity and prevalence of gastroesophageal reflux disease is related to non-alcoholic fatty liver disease. If it is related to characteristic modality of colic, that means the internal activities of dysregulated cholesterol metabolism, if it is related to characteristic modality, we can find the abdominal pain when bending over is typically found in gastroesophageal reflux disease. Otherwise, abdominal pain while reclining and relieved by sitting up is often retroperitoneal. But experience of Dr. Pierce, what he says in his plain talks on Mitra Medica, also opens a door on the positive action of diascoria even when patient gets relief on bending forward. If it is related to cardiovascular affections, the internal activity of dysregulated cholesterol metabolism, we can find the cholesterol and triglyceride changes are considered as important predictors of ischemic heart disease. Similar to the coronary artery disease, they have also an active role in the development of peripheral vascular diseases. If it is related to sexual affections, the cholesterol is the precursor to the production of dehydroepiandrosterone hormone, and androgens or estrogen is made from dehydroepiandrosterone. The hyperactivity of cholesterol-based hormones, DHEA, dehydroepiandrosterone, and/or testosterone might be responsible for increased sexual response. And estrogen is related to false labor-like pain in female. And if it is related to the host defense mechanism, especially some infectious conditions, phelon or paronychia, it has been found that herpes simplex virus type 1, its replication depends on cholesterol. And herpes simplex virus 1 is responsible for several infective disease conditions, as also found in Whitlow or paronychium or phelon. Hypercholesteremia is found to be associated with lymphatic vascular changes, leads to obstruction of lymphatic drainage, which results impaired lymphatic function predisposed to infection like paronychia, phelon, etc. And if it is related to sciatica or peripheral neuropathies, we can find altered cholesterol metabolism may also play a role on peripheral neuropathies. And hyperlipidemia is a novel risk factor for these. On the other hand, the atherosclerosis of arteries supplying the lumbar region has been suggested as a mechanism leading to intervertebral disc degeneration causes sciatica. And if it is related to urethral stricture or false labor-like pain, related to estrogenic activity of dysregulated cholesterol metabolism, we have already said that cholesterol is the precursor to the production of estrogen. In case of false labor-like pain, estrogen induces the formation of oxytocin receptors in the uterus and make uterus sensitive to oxytocin, which is responsible for labor-like pain. In case of urethral stricture in male, a large amount of estrogen causes atrophy and fibrosis of the spongy and cavernous bodies of the penis, depriving the urethra of its normal elasticity, which results in stricture. So, the dysregulated cholesterol metabolism the internal activities of dysregulated cholesterol metabolism can cover the symptomatology like feeble digestive power with dysentery or diarrhea with colic, modalities related to abdominal pain relieved by sitting up, but pain when bending over is found in gastroesophageal reflux disease, increased sexual excitement, ischemic heart disease, peripheral vascular disease, also for the Whitlow or panorrhesium or Phelan, peripheral neuropathies and sciatica, liver-like pain, or the urethral stricture. So, the pathogenesis of Diascorea villosa, like feeble digestive power and their characteristic colic with diarrhea and dysentery with characteristic modalities, increased sexual excitement, Phelan's paronychia, sciatic or peripheral neuralgia, urethral stricture, false liver-like pain, heart affections, muscular affections, all of the pathogens of Diascorea villosa can be covered by the internal activity of dysregulated cholesterol metabolism. On the other hand, on the other side, the diazenin is the primary active ingredient of Diascorea villosa. Its action found in different animal or human models in the scientific experiments. It has been found that it is structurally similar to cholesterol and has significant hypocholesterolemic effects by inhibiting cholesterol absorption, increasing biliary cholesterol secretion, and increasing fecal excretions. Diazenin can elevate high-density lipoprotein, the good lipoprotein, and can decrease low-density lipoprotein and triglyceride levels. Diazenin also has estrogenic property. It has an influence on secretion of dehydroepiandrosterone hormone. The other property, other than the pathogenesis of Diascorea villosa, the other property of diazenin related to dysregulated cholesterol metabolism, it has protective effect against atherosclerosis. It has anti-diabetic property. It has anti-cancer and apoptotic effects on cell proliferation, especially in case of colon tumors, breast adenocarcinoma, hepatocellular carcinoma, gastric cancer, prostate cancer, and in osteosarcoma. So in conclusion, the dysregulated cholesterol metabolism related activities can be considered as the background pathophysiology of homeopathic pathogenesis of Diascorea villosa. If it is so, in addition to the recorded pathogenesis, other pathological conditions related to dysregulated cholesterol metabolism, such as dyslipidemia, atherosclerotic affections, diabetes, intestinal allergic affections, different types of malignancies in colon, breast, hepatic, gastric, prostate, bones, can be considered for clinical evaluation of Diascorea villosa. These are the references, 1 to 50. And this study also published in IJRH and in IJHS in 2017 and 2018 respectively. And before ending this presentation, I should convey the message of Dr. Barnett. The fact is, we need any and every way of finding the right remedy, the simple simile, the simple symptomatic similimum, and the furthest reach of all the pathologic similimum. And I maintain that we are still well within the lines of homeopathy that is expansive, progressive, science-fostered, and science-fostering. Thank you. Thank you very much.
Thank you, Dr. Kishore, for your excellent, well-researched presentation correlating both Diascorea as a homeopathic remedy and the dysregulated cholesterol metabolism. I would now request Dr. Kusum Chand to give her comments on the presentation.
Thank you, Dr. Matthews.
Thank you, Doctor, for a very interesting exposition on your research. I would like to know whether you've used Diascorea in the treatment of hypercholesterolemia.
Actually, it is related to dysregulated cholesterol metabolism.
Yes.
It's the action of diazonin is for hypercholesterolemia. But when it is in potentized form dilution, if there is any problem in lipid metabolism, so we can use the diascoria accordingly.
But would you like to use it in potentized form or in a mother tincture form?
And obviously potentized form. Obviously potentized form.
And at what level? At a low level or a high level?
Actually, this type of pathological conditions, if it is in pathological level, the lower dilution is preferable.
But you have not used it. It's just a proposition that it can be used.
It is prospective study, and I am doing my research on it.
Well, it's a topic worth researching.
Yes.
Thank you.
Yes, ma'am.
Thank you for it. Yes.
Thank you, ma'am. Thank you, ma'am. Thank you very much.
Thank you, Dr. Kishore. May I now request Dr. Bipin Jain, Principal of Dr. M.L. Davle Memorial Homeopathic Institute, to present his view on utility of peer-assisted learning to enhance clinical skills at bedside. Over to you, sir.
See, we are last couple of days, we are having the feast of a lot of clinical research. We have done, a lot of fundamental research presentations and multiple other areas which have been explored. Now it's a high time that we also look into the homeopathic education and how do we plan the further progress and growth so that we are utilizing our resource to the optimum level with the maximum output. Now that is a thing which we must look into. The other medical sciences who are into the medical, I mean like MBBS courses in India or in outside, has taken a leap quite forward into a lot of medical education research. And we as an homeopath and homeopathic education must look into these areas very, very seriously and should explore the different part of education research. And this is one of the attempt to understand the utilization of resources available to its maximum capacity so that we are able to fetch a better and consistent results and produce a competent homeopath. The person, I mean, my gratitude to both the masters who have started this progress long back. Unfortunately, it did not take a leap and the expansion as it should have been. We are following this at a, in a very, very small areas and in a small region. So it's a time that we expand it to a universal level. The plan of this presentation is the introduction of the problem of clinical training. What are the research questions and how do we answer it? The formulation of research project, understanding of the outcome and what are the implications of the answers and the limitations of the current work and what is a work forward. So now when we are looking at the clinical training in a homeopathic postgraduate institutions where the students are supposed to be there in an institute round the corner, round the day and into the whole course, and they are on the floor in the IPD and OPD seeing patients and developing their skill, attitude and knowledge. With busy ward and too many patients around and the limited time and the continuous turnover, there are a lot of possibilities that we miss a quality, good clinical learning and the care. And all in that specific time and period, how do we utilize our resources so that we are able to maximize our learning in our improving our clinical skill, attitude, and the knowledge. So what are the current issues in a clinical training? We do have trainers, quality trainers, but then they are not available round the clock. The teacher-student relationship sometimes can be threatening and intimidating, and we need to develop a more collaborative and collective learning on the floor so that each one grow at his own pace with the proper support. So what we need is a quality time with the quality resources. So what are the possible solutions? We want to have a friend, a colleague who will help in identifying and who will navigate with us in the ward, who will help us in teaching and maintaining patient notes, and who is available easily and who is one of your companion. Simultaneously, he has to be non-intimidating and non-threatening, and who will reciprocate in ongoing continuous training. And this all led us to explore the peer-assisted learning. There are certain background work done on this, and the essence of those background is majority of wards are full of patients, but need of the medical student is to find a teacher doctor for providing guidance in learning and enhancing skill. So the other thing is to have a colleague whose help can be taken for teaching and also gathering and noting evidence is extremely convenient and fulfilling. Hence, currently learning from one's co-learner and immediate senior is becoming popular. So we thought of exploring this in terms of homeopathic postgraduate education. So we picked up peer-assisted learning. What is peer? Is a similar social grouping who are not professional teacher helping each other to learn and learning themselves by teaching. So it is a peers who are not professional teachers, but they are your colleagues. Engaging in discussion with your peers can be mutually beneficial, encourage and improve your confidence in talking and examining patient is what is a primary concept of peer-assisted learning. So core aspect, how the peer explore is the core aspect of giving you feedback on what did I do well, what did I do not so well, and how can I improve next time. So we took up a research project where peer, how does a peer assistant enhance the bedside skill, attitude, and knowledge? Does peer assistant help in developing bedside skill in absence of faculty? Does peer assistance develop a better teamwork and a mutual respect? And does peer assistant develops a better sensitivity and receptivity amongst each other when you are there round the clock and working in a team? So the objective of the exploration was to enhance clinical skill in receiving patient, history taking, clinical examination at the bedside, thereby enhancing patient care, to develop a collaborative and constructive practices at bedside to learn from peer, to develop a conducive atmosphere of learning from each other, and increase and enhance sensitivity to receive and give feedback to each other in absence of faculty. So what are the essential skills required? The knowledge and attitude at the bedsides are receiving the patient, history taking skills, examination skills, establishing an interpersonal relationship and sensitivity amongst peer, and fostering a learning atmosphere. So we created a feedback form after a pilot study which undertook from the senior batch of 25 students, and we also simultaneously took an input from our 4 medical officers. We then took up a freshly entered MD batch of 25 students. We oriented them about the whole project and the objective of the project, given them the insight about the feedback form, and they were being instructed to take up 1 case per week and give feedback to each other. So total 12 weeks, the 12 feedback form of each students were collected. Then we asked 4 medical, then we did a retro pre-questioning of the 25 students to understand their progress pre and post of this exercise. We also took input from 4 medical officers based on their experience on a pre and post. Then we analyzed the final outcome through Wilcoxon matched pair sign rank test. The domain on which this analysis was done was receiving the patient, history taking skill in terms of chief complaint, associated complaint, history and habits, the personal history, and the history taking attitude, the examination skill, the investigation correlations while taking up the bedside information, and the interpersonal skills. So the central tendencies of pre and post were calculated. The p-values in terms of receiving the patient, history-taking attitude of all the domains were taken up, and we saw there is a significant difference between pre and post, and it was validated statistically. The result revealed that there was a significant change in a clinical skill, the attitude, knowledge, and interpersonal relationship and ability to feedback in this period of 3 months in which the project was done, and it was further validated from the input from a medical officers. The areas which shows further major changes are receiving the patient, exploring the chief complaint, the systemic examination, and the interpersonal relationship with the peers. Now, this was all done in an absence of teacher with the guidance given to the batch and to the students with the mutual feedback form. What were the difficulties we experienced during the study? It was struggle to find, we wanted to find a qualitative and an unbiased assessment criteria and the methods. There were definite multiple variables which would have influenced the whole outcome. The sample size was small, and there was less time to train the group. Since we wanted to take up with the fresh MD batch so that they are not influenced by the other input. Recently, again, I have gone through the literature on this peer review, and I found that there was a conclusion recent based on the meta-analysis done on the peer-assisted learning in a medical education, and which also validates that medical students experiencing PAL benefit in terms of academic performance relative to those not receiving. So the students who experiencing PAL, their benefits much more in academic performance in compared to the students who are not receiving PAL. PAL is of great value in clinical stages of training and for practical skill. The long-term outcomes of the PAL remains a priority for future research. Now, the interesting part is that we already have a direction from master about the unprejudiced observer, the observations, and how one develop those observer skills. We have also got an important part of our drug proving where the observer and observation trainings are being taken. What is needed now is to bring this is a part of formal education. A time should be allotted, and these resources in absence of teacher in round the clock has to be used, and this has to be implemented so that we are able to use a time resource very, very effectively to bring out the maximum output. So, and one of the way in doing is through peer assisted learning, because peers are a rich resource and easily available. Even if we are the colleagues, we all carry a different quality and different insights, different knowledge and attitude, which can be transferred to each other in a non-threatening environment. They can provide the rapid, gentle, and permanent learning at bedside. They promote better learning atmosphere. Now, what is important, another part which was very, very interesting is once you learn the habit of giving and taking feedback, once you are sensitive to each other, it inculcates the quality of receiving feedback, and it further takes you as a learner, which becomes a habit for becoming a lifelong learning habits. And they improve the sensitivity to receive, to accommodate, to collaborate, to cooperate, so that each one of us learn and there is a win-win situation. So there is a recommendation to start these practices on a regular basis, to formulate a proper system and its supervision. A teacher should act as a facilitator and should not participate or should not be present in these exchanges when happen. The timely evaluation to fetch maximum benefits from the available clinical material and enhancing clinical skills at bedside. The project, however, only focused on the feedback at bedside, but the system and practices can be extended to other areas of homeopathic education. So it can go to the OPD, it can go even to the case taking in a specific areas. So we can expand the help where we can learn from peers. Thank you.
Thank you, Dr. Vipin Jain, for your wonderful insights into peer-assisted learning and the importance of PAL in postgraduate homeopathic education. I would now invite Dr. Kusum Chand to give her comments.
Very good thought, Dr. Jain. What I have found deficient in homeopathic learning is that every student or every person or every homeopath, big or small, is not ready to share why and how he has or she has selected their medicine. They feel that what they have selected is the right, and they do not want to discuss on what points they have discussed. So this peer-assisted learning is good because you are able to exchange and you are able to discuss your shortcomings or what points you have missed or what points you have added. But I don't agree with you that it has to be peer-assisted. All peers, all students are same. So from where are you learning? This is good that you are sharing with each other. You are developing the capacity to learn from each other and not be very close-minded that, you know, what I have selected, the medicine, my medicine selection is the best. And I don't want to give any reasons for it. But it should be monitored by a senior person. And this, even a senior homeopaths also have to learn how to train the students. And see, treatment is not only selecting a right medicine. Treatment is also patient management, your bedside manners, how you do that. And see, just selecting the right medicine is not the whole thing. It is, you have to make the patient comfortable. You have to see if the patient has fever, how he will manage the fever, his diet, his, you know, whether he's feeling cold or he's feeling hot, all these parameters have to be, and it has to come from the seniors, and they have to teach, and there has to be a formula or a format in which everyone has to you know, learn, and the capacity to discuss with each other on what points one has selected the medicine. So your idea is very good. At least, you know, you have started the process of sharing with each other your thoughts.
Madam, just I will clarify one issue. This is not a replacement of a teacher-student relationship and learning from teacher. This is not going to substitute the process. It is you know, in a time when teachers are not there, when students are not at 24 hours on the floor, or some seniors are not available, and our experience is that the students are not at the same level. You know, some students have got some good attitude of case taking, some have got good attitude of examination, some have got good skill of finding. So there, amongst their sharing, at least their potential difference and their learning continues when other seniors are not available, which is not possible always to be around. So it is for the resident.
Yeah, no, it's a good idea. It's a very good idea, I think. But only thing is, I feel that.
Yeah, you are right. Otherwise, yes.
Good
Thank
thought.
you, Dr. Vipin and Dr. Chand. I invite our next speaker, Ms. Sandy, to present individualized homeopathic treatment of thyroid disease and standardized case-taking tool in Hong Kong. Welcome, Ms. Sandy.
Hello, good afternoon. Now I'm sharing the screen. Is it audible?
It is.
Okay, thank you. Okay, first of all, good afternoon. I'd like to thank to LMHI for inviting us to have a presentation here to share our work.
各位好啊，多謝 LMHI 俾我有機會今日喺度同大家分享我嘅個案。
Today, addressed topic is individualized homeopathic treatment of thyroid diseases in Hong Kong.
今日咧我嘅 topic 咧就係香港甲狀腺疾病嘅個人化順勢療法治療。
Developed the standardized case-taking tool for chronic patients.
同埋咧一個慢性病患者嘅標準化問症工具。
A little bit of the background. Thyroid disease is an important endocrine problem in Hong Kong.
少少背景啦，甲狀腺疾病咧係香港一個重要嘅內分泌問題。
The second commonest, just after diabetes mellitus.
第二個常見嘅僅次於糖尿病。
Hyperthyroidism is the #1 problem in this category seen in day-to-day practice.
甲狀腺機能亢進症係日常行醫入邊咧呢類疾病嘅頭號問題。
Followed by the hypothyroidism and the euthyroid goiter.
其次咧就係甲狀腺功能減退同埋甲狀腺功能正常甲狀腺腫。
The average prevalence rate for the hyperthyroidism is about 1%.
甲亢嘅平均患病率咧就係大概1%。
Previous studies shown that for chronic disease, the failure rate was 25 to 50% for anti-thyroid drugs.
先前嘅研究表示啦，對於格雷夫病啦、抗甲狀腺藥物嘅失敗率大概係25至50%。
Failure rate was much lower for radioactive iodine and surgery.
放射性碘同埋手術嘅失敗率咧就低好多。
However, the rate of complication is higher.
但係併發症發生率咧就較高。
6% for radioactive iodine, 24% for surgery.
放射性碘就係6% 啦，手術就係24%。
And most of these patients need lifelong iodine supplementation.
大多數患者需要終身補充甲狀腺素。
Being one of the most common endocrine complaints in patients seeking help from homeopathy in Hong Kong.
作為咧喺香港尋求順勢療法幫助嘅患者最常見嘅內分泌問題之一。
It is important to improve the consistency of our performance in helping these patients.
改善我哋喺幫助呢啲患者方面咧有一致表現非常重要。
Therefore, we established the standardized case-taking tool for chronic patients, but not only for the thyroid disease patient, in general, all the chronic patients.
咁所以我哋就發展慢性病患者嘅標準化問症工具，唔係淨係俾甲狀腺病人，亦都係俾所有病人。
In part 1,
喺第一部分
practitioner, when they crack the case, we want to make sure they will not miss out any important things or most peculiar things about the patient may appear in this category.
治療師問症嗰陣時咧，我哋要確保咧佢哋唔會遺漏一啲最重要資料啦。
Family history,
家族病史、
drug history,
藥物史、
past medical history,
過去病史、
checklist of all symptoms, systems from head to toes.
要有一個疾病嘅清單啦，由頭到腳趾。
This will not missing any significant past medical history.
咁咧就唔會遺漏任何咧嗰個疾病啦。
Clustering of disease onset in the timeline.
同埋喺時間線上面咧，將嗰啲疾病分類。
Part 2.
第二部分
Chief complaints.
主數。
We will consult on the onset position, quality, relieving, aggravating factors, severity, time or duration, and this is how are the patient affected.
咁我哋會問咧開始時間啦、位置、性質、加重減輕因素、嚴重程度、時間啦，同埋影響，你係點樣受到影響嘅咧？
We may not go through all the chief complaints of the patients. We will choose 3 active dynamic symptoms because patients may have dozens of complaints, but we choose 3 active dynamic symptoms is because you can show the particularity of the patient.
我哋咧唔會問晒病人所有嘅症狀嘅，淨係會問3個活躍嘅動態症狀啦。因為病人咧佢可能咧有好多症狀，我哋淨係問最重要嘅。
Part 3.
第三部分
Life story.
人生故事。
And volunteer a description of the patient at different stage of life.
自願咁描述咧病人喺人生嘅不同階段。
Focusing on the life events at a time when diseases caused us.
關注疾病聚集出現嘅生活事件。
This is we can see the important things are already seen in the timeline.
咁咧，你哋可以見到咧，就係喺時間線上邊已經有晒重要資料㗎啦。
If we go through these 2 guidelines, cannot get enough information from the patient, Then we will set up a open questions about important stressor in life if appropriate.
咁若果咧咁樣做法嘅話咧，都仲嗰啲資料都唔夠嘅話啦，咁我哋咧就會問咧一啲關於生命中重要壓力源嘅開放性問題啦，特別係一啲更封閉嘅患者入邊。
Especially in more closed patient.
係啦，對於一啲比較內向嘅患者就需要咁做啦。
Part 4.
第4部分
We will discuss about fear.
我哋會探討恐懼啦、
food aversion or desire.
食物嘅厭惡同埋渴望，
This is mostly especially in patients' childhood.
集中喺童年時期啦。
Dreams,
夢境，
especially repeated ones or dream fever.
特別係重複嘅夢啦，或者發燒期間嘅夢。
Let's share a case of a grave disease patient.
咁我想分享一下一個格雷夫氏症個案。
50 years old male,
50歲男性，
first seen in 2012.
首次出現喺2012年。
Hyperthyroidism refractory to antiviral drug.
抗甲狀腺藥物難以治療嘅甲亢。
Radioactive iodine or surgery was suggested but refused by the patient.
曾經建議進行放射性碘同埋外科手術，但患者拒絕。
Associated with the palpitation, weight loss, and insomnia since the onset of the thyroid problem.
甲狀腺疾病發作之後，伴隨心悸、體重減輕同埋失眠。
Other complaints:
其他不適，
recurrent hemorrhoid,
復發性痔瘡，
since 6 years old.
6歲開始。
First operation was in his 20s.
第一次手術喺佢20幾歲嘅時候，
Recurred every few years.
每隔幾年復發一次。
With pain and massive bleeding, desperate multiple operations.
多次手術之後仍然有疼痛同埋大出血。
Was having massive bleeding again when he first started homeopathy.
當佢第一次開始用順勢療法嘅時候，佢又開始大量出血啦。
He also got a systematic gallstones.
佢亦都有無症狀膽結石。
At the first custard.
Disease. 第一組疾病
6 to 12 years old.
6至12歲。
Little brother was born at that time, and the patients that became bad temper, always shouting at the patient, and he was always very fearful of him, was shocked and frozen when he suddenly yelled at him.
弟弟出世啦，爸爸脾氣暴躁啦，總係對我大喊大叫，我咧總係非常害怕佢啦。當佢突然衝我大喊大叫嘅時候，我就感到震驚同埋呆住咗。
Just want to run away from him. Feeling palpitation and pulsating headache when I'm fearful.
我淨係想逃離佢啦，喺我驚嘅時候就感到心悸同埋搏動性頭痛。
The pulsating pain at the anus where the pulse got swollen.
肛門嘅搏動性疼痛啦，痔瘡就開始腫脹。
He dared not to tell anyone about his fear and sickness. Felt guilty of being sick.
我唔敢話俾任何人聽我嘅恐懼同埋疾病啦，同埋因為患病而感到內疚。
In these cases, we can see the patient had a theme of fright and fight, and also the elements of psychotic.
咁咧喺呢一組疾病入邊啦，我哋見到病人咧有個主旨啦，就係嚇驚啦，同埋逃跑啦。
Second custard, 18 years old to 20 years old.
第二組疾病就係18至20歲，
Hanging out with gangs at that time.
同幫派混在一起。
Getting shocked by those violent acts, bloody act. I want to run away, but he was like lumped and was not able to move his legs.
被呢啲暴力行為嚇驚啦，我想逃跑，但我好似麻木咗，喐唔到我對腳。
Recurred and then persistent bleeding from the pulse. Firstly operated at early 20s.
復發啦，然後持續出血，首次手術時間就係20歲初。
The first custard at 36 years old.
第三組疾病就係36歲嘅時候，
The patient got married.
結婚啦。
Shocked by the attitude of his wife. She shouted at him often, and he was so fearful of her that he needed to avoid seeing her by staying at the office till very night and watching scholar games at the living room instead of sleeping in the bedroom and so on.
被妻子嘅態度所嚇驚啦，佢成日鬧我，我非常驚佢啦，所以我需要避免見到佢啦，例如喺辦公室留到好晏啦，喺客廳咧睇足球比賽，而唔係瞓喺卧室等等。
Insomnia, weight loss, and hyperthyroidism was found.
同埋發現咧失眠、體重減輕同埋甲狀腺機能亢進。
FFA,
作戰同埋逃跑行動，
fear of darkness, ghosts, and snakes.
害怕黑暗鬼同埋蛇，
Hide up or ran away.
要匿埋同埋逃跑，
There was a need to cover up his fear in front of others.
需要喺人哋面前掩蓋我嘅恐懼。
So you can see the patient got a theme of solemnity and the psychosis that we prescribed Fabiana for the patient.
咁所以咧，你見到病人咧係有個主旨就係茄科植物啦，同埋蘇倉脹氣，咁所以我哋就處方咗 FAB 啦。
It slowly ran up from 30C, 200C, and then 1M.
慢慢咁樣由30C、200C 升到1M。
Sleep improved with much less early waking since the first month.
從第一個月起啦，睡眠就有改善，早起次數大大減少。
The palpitation significantly reduced since the first month.
自第一個月以嚟啦，心悸明顯減輕。
Pulse subsided gradually in 2 months and no more recurrence for 9 years now.
痔瘡出血喺2個月之內逐漸消退啦，9年內直到依家都冇復發。
The free T4 and then the TSH returned to normal after 6 months and no more recurrence for more than 8 years now.
FT4 同埋 TSH 啦喺6個月之後恢復正常，8年之後都冇再復發。
Here is the monarch. We can have the score of this case is 8 out of 13.
呢個就係順勢療法嘅標準評分啦。我哋見到13分入邊有8分嘅呢個個案。
Okay. Was there an improvement in main syndrome?
主要症狀有冇改善呢？
Obviously, in this patient, he got great improvement and the thyroid system and also the bowel, the hemorrhoid system. So yes.
好明顯啦，呢個病人嘅甲狀腺症狀同埋痔瘡症狀都有改善，所以係嘅。
Did the clinical improvement occur within a possible time frame? Yes, his improvement is within 1 month, and he got a long history of PAL, of the also PAL with, and also the thyroid problem. The time frame sounds possible.
咁咧，佢嘅症狀改善係咪喺合理嘅時間框架入邊咧？咁係嘅，佢嘅病情喺1個月之內得到改善啦。佢有好長嘅痔瘡出血史同埋甲狀腺問題，呢個時間框架入邊改善係有可能嘅。
And was there initial aggravation of the symptoms? No, so we click 0.
有冇初期隻症狀加重咧？冇嘅，所以我哋揀咗0啦。
Okay, did the effect encompass more than the main syndrome or conditions? Yes, because his sleep, the insomnia, and also the palpitation are all improved along with the PAL and the hemorrhoid. Is it like a generalized kind of improvement?
咁咧效果係咪超出咗主要症狀同埋狀況咧？係嘅，因為佢嘅瞓覺啦、失眠同埋心悸咧都係隨住痔瘡而改善嘅，咁所以係一個全身性嘅改善。
Did overall being improved? Yes, of course. Well-being, his sleep is improved, energy improved.
咁佢整體係咪都有改善咧？係嘅，佢嘅瞓覺改善咗，精力都有改善。
Did some symptom improve or the opposite order? In this case, it's not very clear in this point.
症狀係咪用反方向痊癒嘅咧？咁呢個個案入邊就唔係好清楚。
Okay, did at least 2 aspects apply to the order of improvement of symptom? Not too obvious, but to be conservative, we click not sure.
咁咧，以下呢2項係咪最少適用於呢個痊癒方向咧？由重要器官到次要器官，由內至外，由上至下。咁呢個個案就唔係好明顯，保守起見，我哋就唔揀，唔確定啦。
Did all symptoms appear? His symptom is quite active, so click 0 for this.
舊有症狀有冇再出現咧？佢嘅症狀都幾活躍嘅，所以呢題我揀咗0分。
Are there alternate causes that can prove his disease? For this patient, this is a case of refractory to an antiviral drug. So also during the treatment period, he was no longer at any drug. For this kind of hyperthyroid cases, refractory to multiple cycle, he has finished 3 cycles of the antiviral drug. Each cycle at least lasts 1 year. And then his thyroid problem keeps on recur. And then now after homeopathy, has not recurrence more than 5-8 years now. So it is not too likely that he's due to the spontaneous recovery. So this one we take not likely to be other alternate causes.
咁有冇其他因素咧會導致有可能嘅症狀改善咧？咁對於呢位患者嚟講啦，呢個係一個抗甲狀腺藥物難以治療嘅病例嚟嘅。咁咧喺治療期間啦，佢又冇再服用任何藥物，因此咧對於呢種多個週期難以治療嘅甲狀病例，佢已經用過3個週期嘅抗甲狀腺藥物治療，每個週期至少持續1年，但佢嘅甲狀腺問題不斷復發。因此咧，使用順勢療法之後，佢嘅甲狀腺問題有8-9年都冇復發，所以佢冇乜可能係自然康復。所以我哋認為咧冇乜其他因素係會導致改善疾病嘅。
Okay, what's the improvement confirmed of the by the objective evidence. Yes, we got the blood test. We have the 3T4 and TX results. The repeat dosing with improvement. Yes, in this case, every time we repeat the doses when necessary, and the symptom improved.
咁咧有冇其他客觀證據證實咗健康狀況嘅改善咧？係嘅，我哋有做血液測試啦，有 FT4同埋 TSH 結果，同埋我哋有冇重複療劑咧？係嘅，有嘅，我哋喺必要嘅時候重複療劑，然後症狀改善。
So overall, we got a score which can indicate a good causality.
咁所以咧可以表明有一個好好嘅因果關係。
So we can have also the other thyroid diseases also benefit from the individualized homeopathy. So here is the euthyroid multinodular goiter. Yes.
Sorry to intervene. Your time's up. You'll have to conclude.
Thank you.
咁咧我哋咧其實其他甲狀腺疾病亦都可以從個人化嘅順勢療法中獲益嘅。呢一個係正常甲狀腺多結節甲狀腺腫。
Thyroid eye diseases.
呢一個就係甲狀腺眼病。
And here is the conclusion. The individualized homeopathic treatment could be helpful to quite a diverse spectrum of thyroid diseases. And also a standardized case-taking tool for chronic cases could also help to bring more consistent performance about different practitioners.
個人化嘅順勢療法治療可能有助於治療多種甲狀腺疾病嘅，針對慢性個案嘅標準化問症工具有助為唔同嘅從業者帶嚟更一致嘅表現。
Thank you for your attention.
多謝你哋關注。CPD 曲 HF193C HF193C。
Thank you, Dr. Sandy, for your excellent presentation on standard case-taking tool and its association and its relationship with the individualized homeopathic case-taking thyroid diseases. I would request Dr. Kusum Chand to give her comments on this.
Thank you, Dr. Sandy, for an impressive presentation. I would like to ask you one question about the first case. How often did you have to monitor the case? Did you monitor the case after he became well? And how often, how frequently you monitored that case?
We monitor the case. The patient will come back to the follow-up every twice week, 2 weeks. And then we will ask for the blood test for his 3T4 and the TSH every 2 to 3 months.
Every 3 months?
Yeah.
Okay. And when did you repeat the medicine? Did you have to repeat the medicine?
Yes, we will repeat the doses when.
At what level? At what level did you repeat the medicine?
30C, 200C, and also 1M is also when the patient come to follow up, we will repeat the doses when necessary.
Okay. So was it connected with the TSH levels or it was subjective symptoms?
We connected to the subjective system.
You were not checking the laboratory investigations or thyroid profile of the patient?
No, we will see the approach and also see the blood test, the 3T4 and the TSH.
Blood test every 3 months or?
Yes, sometimes every 3 months. And if we can see the result in the earlier stage, we will ask him to do it monthly.
Okay, good.
Thank you, Ms. Sandy.
Okay.
Now I invite our next speaker, Dr. Sunil Balinge, to give his presentation on case-based learning method to enable rational decision-making in pathology. Dr. Sunil, I request Dr. Sethi to please mute herself. Thank you.
Good morning.
Morning.
Yeah, good morning. I'm audible to all?
Yes, you're audible.
Yeah, thank you very much, madam. Good morning to all the respected dignitaries, the delegates and speakers at the LMHI. It is a great honor to present the work we have done at Dr. M.L. Dhole Memorial Institute, Palghar, India. I am Dr. Sunil Balinge. I'll be presenting this work, and the co-authors are Dr. Prashant Tamboli and Dr. Devangini Broker, who are my colleagues in the same institute in the research department. I am going to present. I'll be presenting on the topic of case-based learning method to enable rational decision making in posology in the first year MD students. The plan of my presentation is as follows. The need of the project and the experiences, planning of the project, implementation, evaluation, and the learnings derived. We all as homeopaths know that knowledge of posology is essential to treat the patients judiciously and rationally. Learning and teaching its application in practice is difficult, and we have all experienced we learn this in a didactic classroom teaching during our undergraduate years. As a clinician, we continue to learn from our patients. This is what we have been experiencing in our institute by our esteemed teacher, Dr. LMHI, who taught us that patients are our best teachers. And what we learn from experiential learning, the insights which are derived can be applied in clinical practice. So as a teacher, we also need to learn the appropriate methods and techniques so that we can demonstrate the integration of theory and practice to our students. Case-based learning is a method which is based on adult learning principles. In this method, it allows in a structured way for a learner to identify and analyze the problem in a given case. It also helps in developing a spirit of scientific inquiry. It encourages self-evaluation, which is the most important step in developing critical reflection. And this enables a student to develop rational thinking, which can enhance the rational decision-making skills in clinical practice. So this is what I plan to present of the work which was done on the MD students part 1. The objectives of this is to demonstrate the application of case-based learning in developing rational thinking in posology for homeopathic students, to improve the patient care, to evolve the rational decision-making skills in practice, to develop a conscious awareness, structured thinking, which will benefit patient care, and also to enable students to establish correlation between theory and practice from the principles and concepts of organon, and motivating the students to use the planning and programming tool of the SCR in deriving posology in IPD and OPD. The methods which were followed was 14 students of the MD Home Part 1 participated in this study. A study of literature was done on CBL from the standard textbooks of educational technology. 3 cases of rheumatological disorders which were successfully managed by homeopathic treatment were selected. The case material was prepared by formulating suitable objectives and directives. An orientation session was taken for the students to explain the concept of CBL, and we conducted 3 group sessions over a period of 1 week at a 1 week interval on each of the cases, case 1, case 2, and case 3. Now, what was done in these cases was to develop the rational thinking. These cases were subjected to with the directives which enabled the students to systematically select among the possible choices based on reasons and facts of the case. Then they were supposed to employ the facts which they have studied to certain analytical steps which are essential in selecting the posology to understand the susceptibility. So the relevant facts, observations, and possible outcomes were planned, and then they were encouraged to take a particular course of action. Now, this needed to organize our tool of planning and programming on these lines. So this is a planning and programming tool which we are using in our standardized case record to plan the posology. These are the 10 parameters which are used. The susceptibility of the tissue, the sensitivity of the mind and the nerves, whether there is suppression in the case or not, the correspondence of the constitutional medicine, the degree, the correspondence of the intercurrent remedy, the stage of disease, functional, structural, the general vitality of the patient, the fundamental miasm, the dominant miasm, This at this levels, the student has to first identify the fact with relation to that area. Then they have to analyze it, evaluate it, and suggest the potency choice and repetition. What was done was for the objective assessment of this process, we did a performance evaluation of the case which they had worked out. So 3 marks were given for each correct answer, 2 marks for partially correct answer, 1 mark for attempted but error, and no marks for no attempt. So each of these parameters were examined out of 50 marks for identification, analysis, and evaluation. So this was analyzed over 3 cases, and we applied the Friedman test for the statistical analysis. Now this was the performance analysis, and other was a perception analysis. This was done, the student has to write an evaluation form at the end of each session, which will on the following lines. The objectives stated in the case, whether they were achieved or not, the comprehensiveness of the case material suitable for the objectives, the preparation of the self-participant and the guide, the facilitator, whether the methodology was relevant to the stated objectives, and evaluation of the conduct of participants and the guide, and difficulties, experience, and suggestions. And also at the end of the entire module of 3 sessions, they were supposed to write the learning points with respect to whether their knowledges and skills have improved in terms of clinical diagnosis, in terms of assessment of susceptibility, the most important step in planning posology, miasm, suppression, selection of potency, and repetition, and whether they gained any knowledges general at a general level or a specific level, and to what extent their judgment has improved. So they have to give marks to whether improved, partly improved, or not improved. So this formed the basis for the perception analysis. Of the 40 students, there were 7 students who completed the entire module. The other group had missed one session of it due to some unavoidable circumstances. So when we try to study the performance of these students from case 1 to case 2 to case 3, as the module progressed, we see that the marks have improved. The average marks in the first case was 15.57, but in case 2, the performance improved to 19 marks from the assessment, and in case 3, the average was above 35. So the forecast line indicates that more such case experiences can result into significant improvement in the performance. Friedman test was applied as the data was quantitative, non-parametric, and serial test scores were available. So the results are statistically significant. Secondly, we tried to present it on a scatter plot graph to compare whether there is any correlation between the evaluation reports which the student had written, that is their perception of what processes underwent in learning, and the marks. But we could not find a definite correlation, but there was definite improvement in the performance. This possibly could be due to the less sample size. But the evaluation report clearly indicates students experienced correlation in theory and practice. They appreciated the value of CBL as a structured way of learning method, and the difference in perception evaluation and performance evaluation indicate that the confidence level will reduce with passage of time, but definitely they will improve with continuous practice of this system. The learnings which I could derive was case-based learning is essential to teach susceptibility assessment and planning and programming in posology. Patients are our best teachers. Learn from the cases. Preparing case material for this method of teaching is again an art, and this will definitely develop a good insight about what is needed in practice, also for the teachers and also for the students alike. The feedback of the post-module questionnaire showed that the teachers could receive, that the students could receive answers to their difficulties as the sessions progressed and could experience guide as a facilitator. It has helped the participants to enhance skills, rational thinking, and develop a desire to learn and contribute to the process of lifelong learning, which is a very important attitude as a professional. And CBL also has applications in other fields of medical education, especially in teaching of homeopathic philosophy and demonstrating the integration between theory and practice. I would like to acknowledge the LMHI for giving me an opportunity to share this paper. My MLD MHI faculty and colleagues, the METT faculty at the MUHS, who taught us these basic principles of CBL and the experience at the institute, which helped enable to conduct this project. My research department colleagues who helped me in doing the statistical analysis and demonstrate the significance of this study objectively. The students who participated in this, our patients, and of course our family, who gives us space and time to expand and grow. Thank you very much. Any questions are welcome.
Thank you, Dr. Sunil, for your insights into case-based learning for rational decision-making in first BHMS students. I would now request Dr. Kusum Chand.
I'm glad that these efforts are being put into homeopathic teaching. They should have been earlier there, but then the effort has definitely started, and it seems like a good program to make the students learn homeopathy or medical skills. And I hope it doesn't remain at the research level. It gets implemented all over, for all the students.
Madam, I'm sorry to interrupt you, but this is the basis on which the institute has been running all the educational program over the years.
I'm aware
and
that
this is the first time we have done objective research on it, on a closed group. The research methodology practiced on this method was first time done to compare the performance and perceptions.
It's a good effort. It's a good effort.
Thank you.
Thank you. I invite our last speaker for this session, Dr. Bishwajit Basu, to present the scope and limitation of telemedicine in homeopathic practice. Dr. Basu?
Yes, please. Good afternoon. May I audible?
Yes, you are audible.
It's my pleasure. Just now I am sharing my screen. Good afternoon, our respected chairperson, all coordinators and the moderators, and the dignitaries, and all the panelists, and all the audience. It's my pleasure to share my experiences before the learned gathering across the globe. I do like to pay my thanks and gratitude to the organizer. My today's topic is scope and limitations of telemedicine in homeopathic practice. As it is being defined by World Health Organization, the delivery of healthcare service where disease is a critical factor by all healthcare professionals using information and communication technologies, the exchange of valid information minded for diagnosis, treatment, and prevention of disease and injuries, research and evaluation, and the continuing education of healthcare workers with aim of advancing health of individuals and communities. So today's discussion objective is to assess the scope and limitations of telemedicine in homeopathic practice and to minimize the hurdles and optimize the scope of healthcare delivery system where physical communication is possible and not allowed. Introduction. Telemedicine would also take care of situation where urgency is an essence, non-availability of medical practitioner is a situation, and external condition or situation are not conducive to make direct contact between the patient and the homeopathic practitioner. There are certain norms and forms and protocols depending upon different countries regarding evaluation, management, and all other things. There should be some norms and protocols, and that should be followed and obeyed by the homeopathic practitioner. So I do like to highlight the scope of telemedicine. Telemedicine provides patient safety as well as doctors, health and worker safety, especially in situations where there is a risk of contagious infection like pandemic COVID-19. A telemedicine visit can be conducted without exposing staff. Telemedicine provides rapid access to medical practitioners who may not be available in person. Telemedicine will not only encourage social distancing in a special situation of epidemics and pandemics, But talking to doctors will allay their anxiety in their situation of complete lockdown. With telemedicine, there is higher likelihood of maintenance of records and documentation. Written documentation increases more protection to doctors as well as patients. Telemedicine, when effectively used, it reduces the burden of secondary healthcare system also. Telemedicine is useful for regular routine checkup and continuous monitoring and minimize gaps in timely follow-ups. Now I would like to elicit the commonly used three modes of communication. You all know video, audio, and text-based. The video mode is very user-friendly and it staying having much more than all the communication methods. Almost it is closest to an in-person consult, real-time interaction. Is dependent on high-quality internet connection at both the ends. That is the important thing. Else will lead to suboptimal exchange of information. Otherwise, it is very good. Since there is a possibility of abuse and misuse, that should be considered. Regarding audio, it is very convenient and fast. We all know, suitable for urgent cases also. No separate infrastructure needed. Only simple any mobile phone is more than sufficient. Privacy ensured and real-time interaction is possible. But not suitable for observing a real condition that require visual inspection like skin, eye, tongue, especially in homeopathic consultation, facial gesture, emotional expression, etc. We should miss through audio communication. Another important thing is text-based. Almost it is very necessary with audio and video. I do like to suggest it could be possible the integrate approach of the three media that could be more possible. The text-based is very convenient and quick. The documentation and identification may be an integral feature of the platform, suitable for urgent cases and follow-ups. But it is very difficult to establish rapport with the patient through text media. Not only that, it may not identify the doctor and the patient properly. But through text only, we can get the written consent from the patient. So telemedicine should be appropriate and sufficient as per the context of homeopathic philosophy and homeopathic science. And the homeopathic physician concerned should be very cautious and very unprejudiced to decide whether a telemedicine consultation is possible to the particular case or not. And after completion of telemedicine, we should issue a prescription and to transmit it to the patient through digital media. Now it is a flow sheet on the first consultation. Any patient may seek for consultation. There are three modes we may suggest to that patient, and after that they should reproduce some information in written context. Then we should ask for the written consent. That is very important, implied. After getting the written consent, we should ask for the brief history of the present complaint. And if we consider the patient is suffering for any emergency and they should need any emergency institutional care, on spot, we should refer that patient for emergency care and institutional care. But if the answer is no, we may take time. We go for detailed patient evaluation. And in those cases, once again, after making the detailed evaluation, we should once again judge whether the case is possible for treatment in this platform. Otherwise, we should refer that patient for emergency. But if it be possible, in those cases, through this platform, we should advocate the management both for health education, counseling, and the specific treatment, homeopathic treatment, and appropriate homeopathic medicine. But telemedicine having limitations in two aspects. One is clinical, another is technical. Clinical aspect is very important. We should consider and appreciate these limitations in every case. Fast aid and life-saving measure where it is very important, that should be considered and that patient should be referred. In cases, patient who needs physical examination and other assessment essential for diagnosis, that patient should be referred to institution. But patient, those who are suffering for any disease and needs physical examination and investigation, but has been already diagnosed, but any institution, that may be allowed for telemedicine consultation. But technical aspect is very important. A limitation of infrastructure and unstable communication tools and internet facilities are very important thing for limitation of purpose. Now, observation. During last 1 year, about more than 300 new telemedicine consultation has been made by myself, and thousands of follow-up has been conducted. From COVID-19 positive case to myasthenia gravis, and lots of cases I have treated. But one thing is very important. Patient, those are needed exclusive physical examination are not properly assessed with investigation reports, those cases had not been attended. To illustrate, citing a few examples of cases from my brief as a ready reference, how it was possible staying at home, ailing people are getting benefited. Just I am citing few examples. The very beautiful case of a lady about 60 years, and it is a post-COVID case, and she was suffering from goiter. Just I am producing the report in large form. You may see very clearly, large complex says filled with low level echoes and all those things was there. And considering detailed case history and repertorization through Zomeo 3-point software, and I am not simply making the repertorization for getting the calculating result, just to search out the medicine, which medicine will act more. And after consulting the Medic, I prescribed Spongia 200. And after getting Spongia 200, on 27th August, it was such, and on 27th October, there is no growth on the neck. Another very important case that she was actually living in Delhi, and it could be possible as telemedicine was continuing, and she was seek treatment for myasthenia gravis, and for myasthenia gravis, thymomectomy done, but she was suffering from difficult speech. The complaint was difficult in speaking, anxiety. Whenever she was in anxiety, complaint aggravates and could not speak, trembling of hands and being anxious, always feeling sad. Just I am running the video, then you could get it when I am consulting her, how she was so anxious and could not speak properly. Just get it minutely. And first consultation, what she had uttered, I could not understand properly. After that, detailed case taking, I also repertorized through Zomeo software. The medicine first date came Calcaria, then Gelsemium, but I prescribed Gelsemium first occurrence. It is a diagnostic paper on the left side. And the first prescription of Gelsemium 200, only 2 doses. And they procured the medicine from Delhi itself, not from here. And after getting, this is the first video already I have played. Now I am giving the second video. After getting the medicine, what implementation?
What you find from the plants and animals listed in activity. Did you find a large variety?
Now she could utter very clearly. It was the first video. Another important case, actually she was one of the PG student of our institute, the Homeopathic Medical College and Hospital, and she has given a written consent to be treated, and it is her report in detail. It is in enlarged form, CT value was 25, and now she is telling in brief.
Hello, myself Dr. Hasinur Jahan. I have been tested positive for COVID-19 on 15th April, and I took online consultation from Dr. Vishwajit Basu sir and got completely cured by homeopathic medicine.
It could be possible only as telemedicine was continued the time.
Hello, myself Dr. Hasinur Jahan. I have been tested positive for COVID-19 on 15th April.
Dr. Basu, your time's up. I'm sorry to intervene because we're running late already. So please.
Okay.
You,
now I would like to conclude. Appreciating the scope and keeping in mind the limitations of telemedicine, we should consider telemedicine as a need of the hour. In order to treat and prevent of disease, research and evaluation, the continuing education of healthcare workers, with the advancing the health individuals and communities, we should upgrade ourselves at the tune of modern technology. So requesting all homeopathic physicians across the globe, please to practice and adopt this procedure both in individual level and institutional level, with the aim of advancing the health of the mankind in general and in national, both in international level. Thank all of you for your patient sharing. Namaskar.
Thank you, Dr. Vishwajit Basu, for your presentation on telemedicine and the scope in with the prescription. So I would ask Dr. Kusum Chand for her comments.
Thank you, Doctor, for your excellent presentation. And last 2 years, I have also been practicing telemedicine, and it is very useful.
Yes.
And it is a very useful tool except that sometimes you do need to, to feel that you need to examine the patient, but those
Yes.
cases, yes. So once in a while, if barring these conditions, COVID conditions, where, it's nice to see I feel that, one should see, first time one should see the patient.
Yes. Yes.
In normal situation, and then it can be followed up with telemedicine.
Yes.
Other video,
Yeah.
But it is definitely a very good tool, and one should really practice that. Because
one thing I would like to share with you, actually, after getting that experience, most of the patients now they're preferring telemedicine platform in normal atmosphere also.
Yes, it is very convenient
In follow-up,
the patient doesn't have to travel.
Yes,
and,
yes. They are not come to from all the way from Delhi or Hyderabad, from Kolkata to yes.
Yes. That's right. That's good. Thank you.
Thank you. Namaskar.
Namaskar.
Dr. Anu, you have to unmute yourself.
Thank you. We conclude our forenoon session on improving education, practice, and research. Thank you, Dr. Kusum Chand, for accepting our invitation to chair this session. Thank you all the panelists for the excellent presentation. Thank you to all the attendees as well as the organizers. Thank you.
Thank you very much. Thank you.
Thank you, everybody. And I would like to thank Dr. Anu for lovely moderation. Thank you so much, Dr. Anu. It was lovely, and I wish you all have a great day ahead. Thank you.
Shall we make a picture together?
Yes, let's have a picture together. Oh, Isana! Please switch on all your video cameras so that we can see all of you. And the AV team, please take a picture and do let us know once you're done.
Okay, ma'am. Ready, ma'am?
Okay.
Done, ma'am.
Thank you so much.
Thank you, everyone.
Thank you.
Thank you very
All the
much.
best.
All right, thank you.